Hello, doctors. Good evening to all. Myself, Rashid Dave. I am the editor-in-chief and founder of the Ancient Ayurveda. It gives me immense pleasure to welcome you all on this online training session organized by the Ancient Ayurveda Institute of Training. Thank you so much for joining us today. I truly appreciate your presence. For those who are attending for our session for the first time, let me give a quick introduction about the Ancient Ayurveda. The Ancient Ayurveda began its journey in 2020, starting with our flagship Ayurveda magazine. Since then, we have expanded into three major ventures under this name. We publish a bi-monthly Ayurveda magazine, which now reaches over 30 lakh readers across India, UAE, USA, Qatar, and several other countries, which is creating a strong global Ayurvedic community. Over the years, we have also conducted multiple webinars and talk shows. Additionally, you will find a wide range of categorized articles and resources on our web portal, which is perfect for spreading Ayurvedic wisdom worldwide. I am requesting our backend team to please share the registration link for our digital free magazine in the chat, and we encourage you to share it among your groups and networks. If you have not yet subscribed, please do, and do not forget to share your valuable feedback about the magazine. Recently, we have published our latest Recently, we have published our latest issue of the magazine based on the theme Ayurvedic Path to Kidney Wellness. You can read this issue completely free by visiting our website. At the Ancient Ayurveda Institute of Training, we organize regular online training sessions on the most demanding topics in the Ayurveda with highly experienced and reputed faculties. Lastly, under the parent company group, Corifi Group of Media and Publications, we publish educational, fictional, non-fictional, and various other genres of the books with ISBN numbers. This is a quick and author-friendly process. You can get an ISBN number in just 3 working days and a complete book publication in around 15 days. To conclude, we are on a collective mission to promote Ayurveda and bring it into the digital age, and your continued support makes all the difference. Thank you so much for listening me. Now, let us move on to today's session. Before we begin, let me briefly introduce our respected faculty for today, Dr. Anand sir. We are truly fortunate to have such a reputed and experienced academician with us. Dr. Anand sir has completed his BMS and MD from Government Ayurveda College, Trivandrum. He has also completed a fellowship from the Institute of Ayurveda and Integrative Medicine, further strengthening his academic and clinical foundation. Currently, he is working as an associate professor in the Department of Ras Shastra at Government Ayurveda College, Trivandrum. He brings with him, he brings him with 15 years of combined clinical and teaching experience, making his insights both practical and academic. A book authored by Dr. Anand sir on 9 metals and their medicinal importance has been published by the Kerala Bhasha Institute, which reflects his deep understanding of Ras Shastra. He has presented scientific papers at several national and international conferences and was also an invited speaker at the European Ayurveda Congress held in Germany. On behalf of the Ancient Ayurveda and all the participants here today, I warmly welcome Dr. Anand sir and request him to kindly share his knowledge and experience with us. Welcome, Anand sir.
Thank you. Thank you so much for your introduction. Can you share the screen? Yeah. A very warm good evening to all of you. So we are discussing a topic cancer. So actually, cancer is not as easy to handle. We know we need some special approaches to understand what is the pathology, what is the stage of disease, what is the person's bella and all. Then only our treatment will work. And also, it is challenging not only to one medical science, it is challenging to every medical science. And in some of the cases, an integrative approach is more practical and feasible. Even though some of the cancers are treatable, some of the cancers which are in the later stages are not that much easy to treat, but we can have treatment much more. We can give more relief to the patient in many of the stages. Some of the cancers are treatable, and a key for success is an early detection. If you could detect the cancer in an early stage, it is more easy to treat. So even though some of the symptoms they are asymptomatic, like in liver cancer, many of them are asymptomatic, and we will get the patient in a later stage, and it is very difficult to treat. So even if it is challenging, we have a lot of things to offer to the patient. In spite of the modern medical advancements, Ayurveda and the Rasa Shastra has a great role to play in cancer management. And let us come to the point. Cancer is not a disease at all. Even though we call it under the name cancer, it is a process. It is not a disease, it is a process. We have to understand it in a better way. Then only we have to, there is no magical remedy for that. We need to understand it more. Then our success will be more. Then our applications will get more results. So it is a process that happens to be shared over 200 different diseases which have some features in common. Okay. So to consider and think of them as one disease is not accurate and also frightening, because this supposed single disease cancer appear to be infinitely variable. There is a great variation among different cancers, therefore becomes unpredictable and lethal. Next slide, we can go to the next slide. How cancer cells differ? So we need to understand cancer is what happens when a part of your body grows in an uncontrolled way and damage healthy parts. The cancer cells becomes able to escape from the control mechanisms of our body that usually keeps cells in the normal orderly way. So this is the key thing behind this pathology. So it is out of our mechanism, out of our body's control. So that is the most difficult thing to be addressed. So we have to take care about this point, how to tackle this. So even we get a lot of number of yogas having Arbudahara property, it may not work. We have to go a little bit deep into the problem. So next, to understand the nature of cancer cells is to find out what normally keeps our cells in order. How some cells are able to escape from regimentation. So that we need to think. So next slide. So as daily wear and tear takes in toll, there is always an appropriate supply of new cells ready to replace the damaged and lost ones. As a response to injury or trauma to achieve healing, the cells have accelerated their growth rate dramatically and will produce several billion cells in a few days. This is natural to our natural response of our body. Next. So this control of growth, the mechanisms through which control on growth is achieved are contact inhibition, control on growth factors, inhibitory growth factors, apoptosis, that is programmed cell death, oncogenes, tumor suppressor genes, but cancer cells have found a way of avoiding these mechanisms. These mechanisms are normal to our body. But cancer cells have found a way of avoiding these mechanism, and they go out of the control of our body. That is the problem. Next. So the basic properties of cancer cell we need to understand. It goes on multiplying when they should not. So some gene regulations are there to stop the growth, but they go on multiplying. They are capable of crossing the normal boundaries, and it is a type of invasion. It is a type of invasion, and this is problematic. Even though in many of the autopsies, when patients are coming with meeting accident, in road traffic accidents, and autopsies have been conducted, and many of the it is observed that many of them have cancer and even thyroid cancer. A lot of patients, without diagnosing, they are living without any complaint. So what makes it dangerous, what makes cancer dangerous, is that this control mechanisms is lost, and a invasion is being carried out, and all other cells are being affected by this invasion. It affects the other system, it affects the cell, it affects the other physiology, and so the whole body will be affected. Our normal digestion will be affected, our metabolism will be affected, and that is the problem. This is the invasion is the problem, and otherwise the cancer could be a disease like other diseases. So it is not spreading. If it is not spreading, it is like other disease. We need not worry about it. We can control it. But this invasion makes it dangerous. So this is the point which we need to assess in the patient, whether there is invasive other, it is gone to many other places, the metastasis has happened or not. That is very important. So next. So the progress of cancer, the behavior pattern of cancer progression is in three steps. The controlled growth itself, it is a primary tumor. Most of the cancer, it is in this way, it is progressing. First, the primary tumor, then an invasive growth, the invasion to surrounding tissues, and spread to distant parts also through the bloodstream or lymph. It spreads to other parts, distant parts, establishing secondary tumors. So that is metastasis. This is how the cancer is progressing. Next. The progress in different stages are similar to the steps described by Maharshi Susruta as Kriya Kalas: Sanjayam, Prakopam, Prasaram, Sthana Samsrayam, Vikti, and Bhedam. So you look at Sanjayam can be related to the growth factors that triggered up the growth. Pragopam means growing by itself, the primary tumor. Prasaram can be related to invasive growth. Sthana Samsraya means it is distant metastasis. And Vyakti means it may be the secondary tumor. And Bhedam means the stage of complication. So we will get many of the patients in the Vyakti or Bheda stage. That's the most irony of the story. Next. So the cause of cancer, the type of causes we can attribute into two: tendency, triggers, and combination of both. So this is a very thought-provoking thing. So we can see many of the etiology, many of the causes of the cancers. So some say stress is a cause of cancer. Maybe it is a cause itself, no doubt at all. But for some person, the stress is making him dangerous. The cancer is spreading, or it is growing, or it is progressing. But for some person, stress is not a cause of even causing cancer. So even if the exposure is same, the tendency of a patient is also very important. I know many of the patients coming who are vegetarians, who are having a uh, uh, very good what you call dinacharya. And even though they are having a good regimen and a very good food, some of them are even affected with cancer. Why? That is a big question. So that comes the relevance of triggers and tendencies. So for some people, some triggers may be problematic. So if I am a person with Vada Prakriti, so as Vada Visheshan or a causes which aggravates Vada like stress can be a reason. So if I am a Kabha Prakriti person, the stress may not be that much determined there. So what I'm pointing out that even though we can see many of the causes of cancer, the exposures are same, some people are affected. So we should look into the which type of triggers may be the problem behind for each people. So we are this type of phenotypes and genotypes like our Prakriti has a great role in recognizing these things. So some have more tendency that we can see, we can observe in such patients. So next slide. So tendency and triggers. Tendency to grow abnormally is inherent in those cells and that may be probably inherited. And triggers push those particular cells into turning cancerous. So if we can learn which people have the greatest tendency to develop a particular cancer, we are able to give specific and valuable advices about who should try to avoid which triggers. So if a Vada predominant or Vada Prakriti patient, we should advise to restrain him from further tensions. Otherwise, whatever the treatment we are giving, it will not work. Whatever the strategy, we have to develop a strategy such that we have to assess the tendency of the patient. So if it's a stress-prone patient like a Vada Prakriti patient, so for Pitta Prakriti patient, many of the glandular involvement, many of the hormonal and enzymatic involvement may be there. So he has to carry out a regimen that the food should be supplied in the dinacharya in appropriate time. He should not undergo fasting. He should not go for long hours without food, and he should be protected from sun like that. So this Prakriti we have to assess and we have to relate it with the triggers and we have to develop such strategies so that our treatment will work more. That is my point. Next. So nature of cancer causing factors. It should damage the genetic material. In cancer, the genetic material is damaged. Any cell is capable of turning malignant if it is insulted chemically or biologically. So most cells have to be damaged over a long period. We still do not fully understand the factors that control the tendency to develop cancers or the triggers that precipitate it. So any chemical or biological insult can be a factor and a chemical, even some endocrine disruptors may be a cause. Even some preservatives are endocrine disruptors. We are using lot of preservatives. They and even in treatment also we are using lot of preservatives. So we have to be careful while treating cancer patients that we should have a thought on this. We have to we have to safeguard the patient, and the chemical preservatives in any sense, in any form, in the form of medicine or in the form of food, shall be avoided maximum. That is one of the strategy we should take. So in addition to the indications regarding or the drugs regarding cancer, we have to be very careful in each and every aspect. So next, who should avoid who should avoid which triggers? So the following descriptors in Ayurveda may help: Sharira Prakriti, Manasa Prakriti, Sattva Bala, Saram, Desham, Kalam. All these are factors. We have to be very careful about this while examining or while taking care of the patients. Next. So, what is the challenge in treating the cancers? At present, we are unable to detect cancer until it has proceeded nearly three quarters of the way to being potentially life threatening. So, we could begin to detect a lump when the number of cancer cells reached a billion cells. So the number of times a cancer cell needs to reproduce itself to reach lethal proportions is actually quite small, only 42 doublings. And for 30 of those doublings, the mass of accumulated cancer cells will be small to be detected. So we will miss this. So if any behavioral change of the patient or any person you are observing, it should be taken into account, and a regular checkup is needed for detection as an early detection. Next. So the dangerous part, what makes cancer cells so dangerous is that they are able to spread to distant parts of the body and form secondary cancers or metastasis. Because cancer cells are not foreign substances, they usually elude the body's reactions and don't get trapped in a web of blood clot or similar. As they are not recognized by the body's immune system as foreign invaders, there is usually no immune reaction. So they could survive in different parts of the body, different from a foreign body. So it will be protected, and it can elude our immune system. So it will not be recognized, and later it will become a big threat to other cells. That is the problem in cancer. Next. So angiogenesis, it is exceptionally important since no cancer cell would be able to grow larger than a pinhead. It is a process in which cancer cells persuade adjacent tissues to form new blood vessels, thereby bring extra blood supply into the tumor, hence facilitating plentiful supply of nutrients and oxygen for the tumor. So once we are giving, so as rasayanas, we are maybe giving lot of jaggery, lot of sweets, lot of, so it may also cause threat. It may also be problematic because it may also feed the cancerous cells. There is a chance, isn't it? So we have to be very careful. We should not provide such nutrition. So all the sugar part and all should be avoided. That is the best thing to practice this. Next. Other main features, cachexia is a major feature, and the cancer cells interfere with the body's ability to digest and absorb food. This is Agni Mandhyam, specifically Jadaragni Mandhyam, and also it interferes with the body's ability to make muscles and may cause loss of fat and muscle by different ways. Loss of fat, loss of muscle, and cachexia, resulting cachexia. And it is actually not only Jadaragni Mandhyam, we have to address the Dhatu Agni Mandya. So here comes the importance of Rasaushadis. Actually, Rasaushadis directly enter into the Dhatu Agnis. It will play, it will directly enter into the Dhatu Agnis, not only through the digestive mechanism. The Rasaushadis are not absorbed fully after digestion. It is absorbed otherwise. It can bypass digestion. It can directly enter into the dhadus so that this can be addressed well. So this is very important. So these Rasaushadis have much more relevance because of this. Next. So Agni is a major thing which you need to account while treating cancer patients. Agni is a tool in measuring the rate of metabolism. Ayurveda emphasizes the role of Agni and considers it as a pivot around which the remaining factors responsible for maintenance of health and causation of disease resolve. So, apart from digestive function, Agni is responsible for Bala. So, derangement in Agni causes Ama. So, Agni is very important thing. So, you have to be very careful to determine the Agni Bala of the patient. And during the treatment, you have to do periodic assessment regarding whether there is improvement in Agni. If your cancer treatment is working, the main thing is that the patient will get good appetite. The Jadaragni will improve as well as the Dhatu will also be corrected. That is the major thing which you have. So that thing you have to be very careful while dealing with treating patients. So this is very important. So while treating patients, you have to be very careful while assessing the Agni. Next. So you have to be also very careful for evaluating Ama, the metabolic toxins produced in the body. So when you look at the cancer patient, you can see Ojakshaya. The Ojas is no more. The sound will be very low. So we have to increase the Ojas. So you can see, think about the medicine which can increase the Ojas. So do you think any of the Rasaushadhi can increase the Ojas? So very good one. You can select a lot of one, and one among the best one to increase the Ojas and to increase the Agni of the patient is Abragabhasma. So you have to select Abragabhasma, Shadapudi Abragabhasma, minimum Shadapudi is good. So this Abragabhasma increase the Bala, increase the Ojas. So it is Vada Pitta Hara. So I have the opinion that you have to assess the Rasaushadhi and relate with the Doshik as well as Dhadu Avastha. Na Dosham, na Desham, na, that is not good. For assessing, you have to assess properly the dosha shamanatva of Abraga is Vada Pittottara. So it will address the Vada Pitta Kshaya Avastha. So Cachexia is actually Vada Pitta Kshaya. So it is a direct statement of Abraga Bhasma that Vada Pitta Kshaya Gnam. So it will definitely the best one of your best medicine to address the Ojakshaya, the Cachexia of the patient, and also increase the Agni, the Jadaragni as well as Dhatvatni. Next. So you have to get rid of the Ama. So you have to, for removing the ama, we should have some techniques that we will discuss in the coming slide. So in cancer, ama will be essentially present, which indicates the toxic metabolites which may have a role in interfering with the control mechanism of our body. Bela will be poor so that the body's natural resistance is thrown away. So this is the key in Ayurveda treatment of cancer. So you are focusing on the bela of the patient. You have to increase the bela of the patient, otherwise the treatment will not work. So how to increase the bela of the patient? That is very important. So can anybody tell how to increase the bela of the patient? You can also respond. So the best way to increase the bela of the patient and to make our treatment very successful, what is your option? Can anybody tell? Just yeah, correcting the digestive fire. So which is a way to correct that? Any remedy you can suggest very simply?
Langana,
Yeah,
sir.
yeah,
Langana. Langanam.
Langana. But the problem is that you have to design the Langana in such a way that the bela will not go down. In many of the
We
cancer
can go with
patients,
Deepan Pachan, sir.
yeah, Dipan Pachana we can do, and without loading liver, without putting more load on your body, the best way to increase the bala is to give Siddha Magaradaja, because it is a rasayana. It directly absorbs. So whenever you want to increase the bala of the patient, try this. So in cancer therapy, many of the patients are weak. So if you treat the weak patient with any medicine, it won't work. So if you add a portion of Siddha Magardaja, then the chance of your treatment working will be more. So that is a secret. So the patient will respond more. So why Siddha Magardaja is best? I am telling, because it can be directly assimilated by the body. So we need not wait for long periods. Even with 1 hour, you can see some reflections. So that is one of the best way to. So this Beladhishtanam Arogyam Arogyartha Kriyakrama. That is the thing. So you need to focus on bela of the patient. Whenever you are out of focus of bela, whatever your treatment you do, it will not help the patient. So this is our base. So this is very important as far as cancer therapy is concerned. So next. So bela, primarily it provides resistance to the occurrence of disease and decay in human body. Bela provides strength to perform physical exertion. Bela adhishtanam arogyam arogyartha kriya. One more thing I wish to add now. Even after many of the treatments, many patients are coming before you after many therapies, even after chemotherapy, even after surgery. Many of the cancer patients we are getting in many of the stages. So even if they have completed the so-called conventional therapies, they are prone to recurrence. That is a major thing in cancer therapy. So the best way to prevent recurrence, I have found 2 drugs which are very best in preventing recurrence. So we can guarantee that the recurrence will be minimal by the use of this drug. Can you suggest what are the 2 Rasaushadis? Even though they have passed through different types of treatment, even they are taking modern medicine, modern surgery, or even other Ayurvedic treatments, any other therapies, yeah, there is one choice they have come. One is Arogyavardhini, then Tamra Basma, Hirak Basma, very good. Swarna Basma, then Kalyan, what Hirak, Gandhak. So very good. You are
Yes.
answering. You are promptly answering. But the two things which I have found to prevent recurrence, according to my experience, is one Swarna Basma itself, then Hirak Basma. These two things, these two things are very specific in preventing the recurrence of cancer. Swarna Basma and Hirak Basma. These two Basmas are very specific, and I have found that in most of the cases, when I have given the Swarna Basma or Hirak Basma, the cancer didn't recur. So I have full confidence in using these two. Out of many of the answers, Arogyavardhani is a good choice. But as a Rasayana, the best Rasayanas which you can use for preventing or to prevent recurrence is Swarna Basma and then Hirak Basma. So dose, coming about the dose. So you cannot use Swarna Basma in a very, what do you call, in a high dose. Even though 50 milligram is a good dose of Swarna Basma. 50 milligram is a very good dose of Swarna Basma and a practical and effective dose of Swarna Basma. And for Hiraga Basma, every day, even 10 milligram is useful. So this, if you combine Swarna Basma and Hirak Basma, it is good. And in my practice, this dose, even though these are very small, I used to add Abraga Basma 50 or 100 milligram along with this. So this Rasayana can be very useful in preventing or for recurrence of cancer cases. So this Swarna Basma 50 mg, then Hirak Basma 10 milligram, and then the Abraga Basma 50 to 100 milligrams. So that is a very good combination, and you can also use it in patient. You can see Anupana. Anupana, I have been using in most cases honey, but you can use a little amount of Grida also if you need. You can select according to the condition of the patient. Honey is a common Anupana and it is having good effect also. It is Yoga Vahi. So Yoga Vahidaga Dravyam Samyuktasya Prayojanam Uddibet. So getting good result with that, but you need to grind it for, you need not use a capsule. You need not use a tablet. You have to use, you can use it in divide dose or as one dose. I am using it in only one dose, a single dose. So you have to use it. The economic part of the choice of drug, you can add more Abraga Basma, and if the patient is not so rich enough to buy Swarna Basma, you can substitute with even Abraga Basma. So the thing is that you should not use tablet or capsule as such. You have to grind it. If it is in capsule, you have to put it in a mortar, and then you can add a half teaspoon of honey and grind for 3 or 4 minutes. 3 or 4 minutes grinding is very essential. Then only it will be absorbed as such. That is the thing. So everything, we are not giving extracts. We need to be very careful while administering, selecting the formulation, selecting the Anupana, and how to administer. That all are very important. Next. So, possible causative factor imbalance of uh, doshas, perhaps, and the imbalance, we can also assess whether the Vadic predominance is more, Paitic predominance is more, or it is a combination of Vada Pitta. Like that, you have to assess. Next. So you can see all these controlling mechanisms are only under the control of Vada. So everybody says in cancer, Kabhavritti is there, there is a mass, there is a tumor, so Kabhavika is there. But beyond that, you should see in depth, the controlling mechanism is lost. So controlling mechanism, you can see, you have to pacify Vada. So Vada means Gadi Gandhana. Gadi means movement, but Gandhana, you have to understand what is Gandhana. Gandhana means Sujana. Sujana means intimation or signaling. So this signaling system is lost in cancer. This signaling system is affected in cancer. So you have to control the Vada, the affected Vada there. It may be Pranavada, it may be Apanavada, it may be Samanavada. So the major factor behind this is Vada, and the other doshas also have their own role. But the main thing which you need to control is to pacify Vada. Next, Pitta, the Tabba Santabi, the thermogenic activities, if it is, there is a balance in the cancer pathology regarding that. Many of the endocrinal factors are affected. Then you have to think about Pitta. And Kabha means the binding mechanism and cohesion of tissues. So, Slishalingere. So, all these factors have their own role in cancer pathology, but Vada, in any way, in the regimen, in the food, in his habits, in the drug, all you have to focus on Vada vitiation. You have to alleviate it. Next. So the causes enlisted in Ayurveda, Vada controls the other two, and it is Pittam Pangu, Kabham Pangu. So you have to control Vada. And moreover, Vada controls cell division. And Vayu Renam Vibhajadi. So Vayu is regarded as Prajapati, which decides the Prajapatya Krama, which is essentially genetic coding and control. Next. So causes of Vada imbalance, Vega Dharana, Vega Udirana. So the suppression of urges, it may be the modern science, they don't know this. Nisha Jagaranam, abnormal sleeping habits. Atyucha Bhashanam, loud speech. B, fear. Shoga, sadness. Chinda, anxiety. Adivyayama, Adimaiduna, or overexertion. Next. Next. Prevention. So the relevant parts in Ayurveda are Dinacharya, Ruducharya, Annapana Vidhi, Sadvrata. Next. So you have to use safe food, low carbohydrate and rich fiber foods along with the treatment. You have to suggest low carbohydrate and rich fiber and rich protein food. And one of the protein which you can make use in cancer therapy, our drug which has a high protein value, high fiber value. What is that? Any rasayana you know with high protein value and a high fiber value. Can anybody suggest which is a medicine in
Amla.
or Ayurveda? Yeah. Can you
Amlaki.
say? Not that much. Yeah, it is there. Amalagi is good. But Ashwagandha, yes, very good. Ashwagandha has high protein as well as good protein and good fiber in it. Then avoid preservatives, coloring agents, and packaged food. Avoid food processed in oil, too much cold and too much hot. Next, eating habits. You have to be very, you have to instruct the patient. You have to give guidance to the patient. Next, exercise. The exercise makes the patient more good. So I have a patient, I will tell that case in which a prostate cancer for 13 years now, I have been following up the patient, and he is also, now he is not under any medication but fully normal, but with a regular exercise and including swimming is perfectly normal. So we will come to that later. Next. So this Sadvrta and is very good because as we by following Sadvrta, the important thing is that we will get less stress. We will get less stress. That is the major thing. So if you design the day with Dinacharya and Sadvrta, then you will be more stress free. So educate the patient also. That is very important along with the medicine. Next. Next. So these are the Sadvrta. I am not going through this as we need to discuss the Rasaushadis. I am not going in detail. Next. Next. So this cancer therapy, many of the therapies are there: surgery, radiotherapy, chemotherapy, biological therapy. Ayurveda therapy is similar to the principles in which body mechanisms get strengthened. Shodhana therapy to eliminate toxins and rasayana chikitsa to rebuild healthy cells are needed. But avara bala of rogi and the spontaneous progress of the disease is the challenge. So there is a solution. So avara bala of rogi, how can you do panchakarma? How can you do shodhana if the patient is weak and having less bala? How can you do? How can you practically implement? Can anybody tell the solution? So you need to eliminate toxins. Yeah, that is a good one. Good reply. Sadhya
Our Shodan can be
Shodhana.
done.
या पण
Yeah,
अवस्थे सर या
Our
पण
Shodan can be done.
yeah.
Exactly.
Your choices are good. So
मृदु
I shall, yeah, very good. Your choices are all good. I shall suggest you one medicine in which if you give the medicine, they without any jhardi or without any virejana, the toxins will be eliminated every day. Every day the toxins will be eliminated. So you have to prepare it. It is a popular one. Everybody knows it. But can you identify? Everybody knows. Can you
Mahakalyanaka
identify?
Dhritam.
Actually, it is good, but directly it is seen. Directly in its Phalasruti, that medicine, it is written.
त्रिफळा
Triphala is good, but in the Balasruti, it is directly written. What is written?
Chyawanprash,
निवृत्त
Indukantam.
So it is good for increasing the immunity, but I am pointing out to a Rasaushadhi which can be useful, and you will not see any virejana or chardi, but the liver detoxifies. The liver is the major thing which
आरोग्यवर्धिनी
detoxifies. Excellent. So Arogya Vardhini is the excellent option which strengthens the liver, and it helps the liver, the body itself, to detoxify. So there is a scientific way. When you administer a properly prepared Arogya Vardhini, it will help to detoxify the body. So that the Amapachan will be carried out. It is said that why it is so. Urdhada Parishodhanam. Urdhada Parishodhanam. In Tamra, you can see in Tamra, when you look into the aspect of Tamra, what is it? Urdhada Parishodhanam. So Tamra is a content in Arogya Vardhini, and it is balanced by other herbal drugs including Kadugi. So Kadugi is very much liver protective. Kadugi directly acts on the liver tissue. So liver is the thing which cleanses the body. So this helps in eliminating the toxin every day. So that is why the term of that preparation or that medicine comes as Arogya Vardhini, not Arogya Harini. It is Arogya Vardhini because of this, eliminating toxins everywhere. You can see in its Farasudhi, Vada Pitta Kabodh Bhudan Juran Nana Pragarajan. Then Pajani Dibani Padhya. Pajani Dibani Padhya Hridya Medo Vinashini Mala Shuddhigari Nityam. Mala Shuddhigari Nityam. So what is its meaning? Mala Shuddhigari Nityam. So because why it is Mala Shuddhigari Nityam. So it strengthens the liver to detoxify the toxins. So it is a very good choice. You can use in a cancer patient without disturbing his strength. It will not load the patient. It will not trouble the patient, but everyday use, it will reduce the toxins in his body, which makes his bala more. Next. So, Mala Shuddhigari Nityam, that I have explained. So everybody read this sloga, everybody chanting this sloga, but Mala Shuddhigari, without making the patient in trouble, we can do it. So next, can be readily introduced to a cancer patient with no appetite and weak metabolism. It gets absorbed and metabolized quickly. So almost all Rasaushadhas, they are very important and they are very useful because they are, even though they are Dipana and Pachana, at the same time they are Rasayanas also. That is the beauty of Rasaushadhis. So it is very useful for cancer therapy because the Rasaushadhis are at a time Dipana and Pachana as well as Rasayana. You don't give it for different stages. You can, in a pill you will get two. In a pill you will get Dipana, in a pill you will get Rasayana itself. That is the beauty of this formulation. Next. So Rasa Rasayana and Rasa Chikitsa. Many kalpas which with processed minerals have high Rasayana value. And another thing, what is the other benefit of this Rasa Rasayana other than the other Rasayanas like Chavanaprasha, Brahma Rasayana? Can you say? Why this Rasayanas are more useful in cancer patient? We have already told it is Agni, Dipana and Pachana as well as Rasayanas. So, yeah, it bypasses Agni, Sukshmatva, less dosage. Okay, all these are correct. In addition to this, I can tell you that the other parts, like other Rasayanas, like they are adding lot of sugar, lot of carbohydrates. You can see a lot of jaggery. lot of other things, lot of ghee. All this may even give nutrition to the cancer cells. Is it? There is a chance. I don't know fully. There is a chance. But if you use a rasarasayanas, there is no chance of getting these sweets. These sweets are not there. These carbohydrates are not there. These sugars are not there. So we can devoid all this and we can give good rasayanas. They are actually not snigdha rasayanas. They are actually ruksha rasayanas, which are very good for cancer therapy. So I may term it as ruksha rasayanas, which are very good, even though they are brahmana, even though they are also ruksha, even though brahmana they are ruksha, they are not snigdha, they are not sandarpana janya, they are actually regularizing the metabolism, they are not adding any fat. That is the thing. So next one, the bhasmas and rasaushadis, by virtue of their sukshma property, can act in deeper levels. That is also important. You can see the problem lies in the gene. So the gene is so deep. So in order to reach the gene, it should be sukshma. Our intervention should also be sukshma. So you have, so by virtue of different processes, we are making bhasmas, we are making sinduras in upipakva rasayanas. Why they become rasayanas? Because they become sukshma. So dehasya sukshma chidreshu vishededat tat sukshma muchyate. So they can enter to deeper. So it can even go to the genetic material. I will show you one or two direct evidence for that. We will come to that in later slides. Next. So this is a case report of a cancer patient. You can see there is a lesion, adenocarcinoma in the right mid region. There is a lesion. You can see in the right mid region, there is a adenocarcinoma of the prostate. In the next slide, is a biopsy mapping slide. So it is enlarged. Now you can see it in a very fine mode. You can see the lesion in the right mid region. There is a circle there and there is a lesion in it. Next. So after 6 months of our treatment, again biopsy has taken. So now the right mid region, you can even watch that. There is no lesion. Yeah, there is no cancerous lesion there. Next. So it is enlarged. You can see the benign. It has become benign. The cancerous issue is resolved. Next slide. So before going to the next, what is our approach and what are the medicines that I have used in this patient? This was a case of prostate cancer. So understanding the pathology is very important and you have to arrest the pathogenesis. So there is not a magical remedy as a cancer, anti-cancer drug. If you select like that, you will not be successful. So you have to understand what is the problem. So the patient came with the problems in the urination and the frequency of the urination has changed a lot. He couldn't have a control over the urination. Nocturia was there and even the constipation was there. So even the urine and the malapravrti is also affected. And a few, I have also examined the patient that it is very hard through the what do you call per rectal examination. It is very hard. So it has turned cancerous, and the prostate specific antigen was 13.7 then, and you can see a lesion there in the right mid region. So the patient has no appetite and the control of urination has lost. and also constipation, a lot of abdominal gas is there. So what is the problem I need to address? So I have told you the Vata, I am focusing on Vata there. So Abhana Vata is affected there. So I need to make the Vata balance there. Along with that, I have to account a tumor has formed in the per rectal inspection. The tumor has become hard. So I need to address the patient by pacifying the Apanavada as well as regression of the tumor. This is very important. The regression of the tumor is also important. The hardness of the tumor is there. So you have to shrink that tumor. So two things I need to address. First is Apana Vaigunya. Next, that is a dosha viparita chikitsa. And the tumor depletion is Vyadhi viparita chikitsa. At a time, I need to do both. So what I have done, so for addressing the Apana Vada, I have given a decoction. Chiruvilladi Vada is the best one to resolve Apana Vada. And along with that, I have given a drug which is very specific in alleviating tumor, which contains Lekhana Dravya. Lekhana and what do you call? So this Lekhana Dravya, Rasaushadhi, which is having Lekhana property. So I have selected a Rasaushadhi having Lekhana property as well as it should act in urinary system. Then only it will have effect. If Lekhana property acts in any part of the body, you will not get. So you are answering some of the question, and Vanga, one of the answer you have said very good.
Shilajit.
But I have now gone for, yeah, Shilajit also good, but I have gone to a formulation in which Varadiga is a major ingredient. Varadiga, cowries, Varadiga, and it is Chariya, and it has specific action in Mutrakritsra Haram Param, Mutrakritsra. So Shvedaparpadi you are not using, but Shvedaparpadi can have action, but to deplete this cancerous tumor, you need to be more strong. That Lekhana property should be more strong. So this is a peculiar formulation that you can see in Uttarakritsura Chigilsa of Rasarakna Samchaya. And that kauri, you have to fill one part Rasa Sindura and one part, 4 part Gandaga. 1 part Rasa Sindura and 4 part Gandaga. You have to mix and make it homogeneous, and you have to fill it in the cowries. And the mouth of the cowrie is being closed by Tangana. How Tangana is pasted there? It is pasted by forming a paste, the Tangana Pasma with the cow's milk. You have to grind it well and make it a mixture. So you have to fill the cowrie with 1 part of a mixture of 1 part of Rasa Sindura and 4 part of Gandaga. And fill that cowrie and close the cowrie, the mouth of the cowrie, by pasting Tangana in cow's milk, a paste of Tangana in cow's milk. So you have to fill all the cowries and you have to make a puda, Kerava Sampuda or a Gajapuda. You will get good bhasma. After one day you will get good bhasma. You have to grind it well and 250 milligram of this is a very good choice for this. And I have got very good result in this. And what I have given to the patient, first Chiruvilladi Kashaya and this Pasma, and later on, as he developed appetite, I have changed the Vada to Vastyamayandaka Ghruda. So I have given this Basma containing Varadika, Rasasindura, and Gandhaga, and that product, and that is called a Lekhu Logeshwara Rasa, and that it is in Basma form, and I have given it along with the, first I have given with the honey and Chiruvilladi Kvadha, but after 1 month, when I examined the patient, he had developed appetite. This is a good symptom, a good improvement. And the constipation elevated, the abdominal gas trouble and distension down. And also the urinary symptoms are coming to control. But followed the treatment for 3 or 4 months. And after 6 months, I have taken this scan. And actually, he was an NRI. And at that time, in the US, they have taken the scan. And the doctors there, they became very wonderful. They have suggested a prostate surgery for the patient, but the patient was not willing to do. But with our medicine, this tremendous improvement happened. And these 12 to 13 years, I am following up the patient, and there is no trouble. He is now normal, no medicines at all, but taking swimming every day, using less fat food, and he used to eat lot of nuts there, but I advise him to avoid nuts when cashew nuts. Now he is perfectly okay. So what I am pointing out through this case is that we have to see the pathology. Lot of choices are there. Many of you have given lot of choice. Maybe they are also good, but you need to understand, you have to decode the Sambrapti. So here we need Amapajana, Agni, Deepana, the Apanavada have to be addressed, and also the tumor depletion with a very good Lekhana Aushadhi. So another Lekhana Aushadhi is there. I haven't tried in this patient. For many other depleting tumors, we can use another Rasa Aushadhi. What is that? Can you say? Very good. For depleting tumors, very good Lekhana Aushadhi in Dasa Shastra. Very good. Tamra. But Tamra, you have to use it very carefully. Na visham vishamityahu. Tamram tu visham uchyade. So Tamra is a real poison. So you need to select a very good source of Tamra Basma. You have to test it whether it's fine. And you have to give in a very small dose, like 20 milligram or 30 milligram is enough. So the companies, they are asking, many of the companies, Tamra Basma, I have found Sri Dudpa Besar like that. They are good, no problem. So you have to test it, the Basma Parikshas. Even though you are purchasing, you can do a random test for assessing the quality of Basma as a random test by this Rekha Purnatam Varidaratvam. Take a pinch of that, put it in water. If it floats in water, you can use it without any fear. So these are the important things which you need to really ensure before giving to the patient. So Tamra Basma is very good, but you can you name another Rasa Aushadhi which can be combined with the Tamra Basma? I have been using it for uterine cancers. So can you say that? So Hirag is not that much. It is good for improving the strength. Bala also it can be used
Chandraprabha.
in uterine pathology. Not you can use it, but a little more strong one. Very good choice of Rasaushadhi, which you can use it for tumor depletion.
Bhallatak.
Baladak is a good choice, but in Kerala, Baladak, many of the people they have a reaction due to more humid nature. There is greater humidity here. So in north you can use it. Baladaga you can use very well in your place, no problem. But I am telling about nothing other than nobody replied that Rajada very good. Rajada is a good choice, but I am mentioning that about the Rasa Ushadi Nityananda Rasa. Even though it is said in Slipada Chikilsa, in Vaishyaja Ratnavali, you can see in Slipada Chikilsa, it can be used in many of the Abhudas also, in many of the cancers for depleting tumors. So you can combine Nityananda Rasa and the Tamra. It is a very good choice. In most of the tumors, I am using this combination. So there is a very good choice. Out of my experience, I can tell you that Nityananda Rasa and Tamra can be combined. Say if you use 200 milligram to 200 milligram of Nityananda Rasa, you can take, you can combine with 20 milligram of 20 mg of Tamra Basmi. And even in breast cancer, you can use this combination of Nityananda Rasa as well as Tamra Basma. And one more thing you need there in uterine and breast cancer. For both, the medicine may be common to both. For uterine and breast cancer, most of the medicines are working alike. So you can use Anupanas, Varanadi Kwadha, Gugulu Tiktaga Kwadha, or even Nimbadi is a very good choice. Nimbadi Kwadha is a good Anupana. And even though it is not a Rasaushadi, one of the important Rasa drug containing mineral preparation useful in South India is Rasagandhi Medugu. Rasagandhi Medugu. That is also fine here in working well in uterine as well as breast cancer. Rasagandhi Medugu. As a dose of 500 milligram you can use. So that is also working along with Nityananda Rasa and the Tamra Basma. So what I am stressing is that you have to go to the pathology. So for any of the lymph edemas, for any of the lymph involvement, in many of the cancers you can see the lymphadenopathy, the lymph involvement. Nityananda Rasa is a best choice you can use in a dose of 200 milligram. So next. So avastha is important. Amavastha, dhatu, lina avastha. These two avasthas you need to understand. And in cancer pathology, both these coexist. So you have to put a remedy which has both to address both simultaneously. That is the importance of Rasa Aushadhis. Next. Stolpa hi matra vipula gunasya sadyo hi deepana pajanam cha. So the sadya deepana and satya pajana makes it very useful. Rasa Aushadhis. Next. Rasa Prayogam illata vaidyan nannalla kevalam. It is a Malayalam text called the Chikilsaka Chindamani. It is said that the know-how of Rasa Chikilsa alone will make a Vaidya complete. Otherwise, we need, in many of the things, we have to refer. But if you know the wisdom of Rasa, Aushadis and Rasa Shastra, you can survive more. Next. So another case report here is a cholangiocarcinoma, and in cholangiocarcinoma, the bile duct is affected. Next. You can see the scan report suggestive of periambulary cholangiocarcinoma, extrahepatic. Next. Moderately differentiated adenocarcinoma. Next. When the patient came, he has no appetite, pain, abdominal pain, severe itching. That is a major problem, and he is crying. And the bilirubin is 5.3. Creatine, you can see it's normal, but bilirubin 5.3. Then SGOT and SGPT raised 86 and 47. Serum alkaline phosphatase is very much high. So it is a feature of cholangiocarcinoma in which the alkaline phosphatase level is much more. So the patient is having severe itching. So what will you do? So that's why I'm telling you that we have to decode to our pathology. So which Chikitsa will work here? Yes, Virejan will work, but which Chikitsa principles will work here? It is actually Kamala Chikitsa. I have given Kamala Chikitsa. Kamala Chikitsa will work here. So after 1 month, you can see the result of the liver, how better his liver came. Next slide. So you can see bilirubin dropped from 5 to 1, and all the SGPT, SGOT values is now under control. And within 30 days, you can see, even though the serum alkaline phosphatase is raised, it has come down to half. The value has come down from 1500 to 600 something. So it is the patient responded well. Now he gets appetite. The pain is controlled. Even though he has pain, it is under control. The energy level increased. Now he could walk. He could take food. But later the patient lost all because he was a drunkard. He again, after getting relief, he again went to his habit of drinking alcohol. So this in Kamala Chikitsa, within 30 days you can see the improvement. And what I did, as a Resaushadi, I have taken Mandura Bhasma as well as Kanda Bhasma. Mandura and Kanda Bhasma in a combination. Mandura Bhasma I have taken 200 milligram and the Kanda Bhasma 100 milligram. Along with that, I have given Anupana as Drakshadi Kashaya. So Drakshadi Kashaya, somebody has asked about giving a Shodhana with other drugs like what you call Ichha Bhedi. Can be done if the patient is okay. But I have given Drakshadi as a mild thing. The patient was so weak. So I didn't first went for Virechana. But after giving Drakshadi for 2 weeks, along with the Mandura Bhasma and Kanda Bhasma, Kanda is very good. So Skandayo Kamaniya Kandi Janana Suste Churai Prada. Kanda is Kodik Gunadikam. Other than Loha, comparing to other Loha Basmas, Kanda Basma is very good because the oxygenation in the patient will increase. The oxygen carrying capacity of the patient will, the system will increase, and the patient responded well. And the itching has also come down. I have used a Kumari, the aloe vera pulp every day along with the coconut milk for so that the itching has also dropped. The patient got very good relief. So by what I am telling is that if I apply anything as an anti-cancer drug, if my understanding is like that, you will not end up in good result. So you need to decode the pathology. You have to apply Kamala Chikilsa. And for Kamala Chikilsa, you have very good choices of your own. But for this patient, I have given Arogya Vardhini Rasa, then Mandura Basma, then Kandaloha Basma, and Drakshadi Kashayas Anupana. Later, I have shifted the Anupana to Vasha Gluchadi Kashaya. So, all these examples I have elaborated. Why? Because you have lot of choices of Rasaushadis and many other drugs are there. But you need to apply in a very accurate way. Then you will get good results. Next. So this particle size study of a plasma, you can see next slide. So you see this plasma which I have told in the prostate cancer Chikilsa, that I have given a basma of Legulogesh Rasa. I have given it for analysis in TEM, transmission electron microscopy. I have seen that these are the particles in it. And actually the dimension, it was analyzed in Japan. The nanoscientists have analyzed it, and I have seen that the particle size is 2 nanometer. The diameter of this nano tubes, which you can see in the figure, 2 nanometer. So it is less than the size of a cell, which is 5 nanometer. So what why I have put this, because it is so sukshma that it can enter even a cell into the cell, and it can act in the DNA, the genetic material like DNA. Next. So you can see the surface of this nano structure. You can see a lot of gratings, rough surface like gratings, and this is maybe the importance of Anupana. You can see in these gratings many other drugs can be carried, like a rocket picking the satellite to the space station. You can target the drugs to the particular sites. This is a targeted delivery system. That's the importance of Rasaushadis. Next. By virtue of the above said properties like Anutvam, Sukshmatvam, etc., the Rasaushadis acts not only in Annamaya Kosha, it influences the subtle Pranayamaya, Manomaya, Vijnanamaya, and even in Anandamaya Kosha. That was why the yogis made use of Rasa Chikilsa to attain perfection in life. So it is much more deep, and we are not using a heavy metal. We are using a thing which will enter to our subtle, even to our consciousness. That much minute. Next. So it is called Daivi Chikilsa, superior among all treatments, and it is actually an expansion of Rasayana Chikilsa. So we are just equating the Rasa Chikitsa to modern medicine, and we are actually losing our uniqueness, and we need to preserve as such. We can't find any counterpart in modern medicine like Rasa Chikitsa. This is a separate and unique entity which we should make use as such. Next. Rasa Rasayanas, most of the Rasa Aushadas are Rasayana property, having Rasayana property. You can verify it even in textual line and even in your practice. Next. Rasayana is unique to Ayurveda, and Rasadina Mayanam Rasayanam. So it will optimize all the dhadus. Rasayanam means not only Chavana Prash, not only the drugs in the Rasayana Prakarna. It can be anything which optimizes all the dhadus. Next. So the Kshatrikarna is needed, but accounting the bela of the patient. So Pajanam Snehanam Sedo Vamanam Bejanam Tada Edani Panchakarmani. These are the Panchakarmas for Rasaushadis. Next. So next we have already discussed. Next. As a emergency care also we can use in Potali. Potali, we have to research more on Potali. And many of the Potalis are also useful, like Hemagarbha Potali. But I think in my practice, when I use Potali, you have to use it in much more dose. We have to standardize the dose more. So 8 circles like that it is used. But I need to say that Potali is much more useful if you use it in the dose of a Khalvi Rasayana. So if you use a Potali of Hemagarbha Potali, you need to grind it like so that you should ensure 10 mg, minimum 10 mg of Swarna Hemagarbha Potali is there. So you need to give it in repeated rotations. Then only it will work. This is my opinion. Okay. So we need to standardize the dose more. Next. So these are some of the guidelines regarding doses. Up to 1 year for children, many of the cases comes to in pediatric cases. So these are the guidelines. I have taken the guideline of the dose of Rasa Sindoor and Rasa Tarangani. It is applicable. So up to 1 year only 10 milligram is needed, around 10 milligram. Up to 2 year around 20 milligram. Up to 6 year around 50 milligram, 40 milligram to 50 milligram. And up to 12, after 12, 1 dati can be given. 125 mg can be given. Next. You should also keep all the antidotes with you. Next. Some drugs may have some sensitivities, not toxicity. Even turmeric is allergic to some person, even though turmeric is a drug used for allergy. So like that, hypersensitivity may happen, and there are specific antidotes told. You can make use of it, and you can find it that it is you can manage it. There is no nothing like toxicity, but you can manage the hypersensitivity caused due to. After proper Shodhana, there will not be any toxicity, but hypersensitivity you can meet. That you can manage with the antidotes. Next. The rational use is very important. Condition of the patient, dosage, duration, diet, anupana, regular monitoring. These are very important. Next. So for acute problems in cancer patient, while I am treating the a breast cancer patient, even it is an advanced stage, the lungs are also affected. the acute distress is there. So we can use in acute respiratory distress Shwasa Kudhara Rasa, which you can see Adi Mohatva Mabanne Rasam Dadyad Vijakshana. So this Shwasa Kudhara you can use even in as an application of dhupa, you can use it. Not only through the mouth, through you can even use it as dhumapana. Next. So chardi, it is very difficult to manage. So if the patient have, you need to have a support from modern medicine most of the times. But this Laja Churna, Rasa Sindura, Legu Sudeshegar Rasa, Gairiga, all these have some effect, but not fully. I am not satisfied because as the vomiting center get stimulated, you cannot suppress it. Our medicines are not working as suppressants. They are just not suppressive enough. So you need to have some support, some integrated approach is needed there. Next. So dry cough and productive cough you can demarcate. Tangana basma, honey, simple thing as a throat pain or gargle. Then tonsillitis like things, Spadiga basma, then Surya Prabha Guliga, Kabagudar Rasa. All these are some of the remedies. Next. Some patient may accompany all this. Grahani for digestive problems. So even for gastro cancers affecting the gastric area, Swarna Sudashegara is a best choice. Swarna Sudashegara Rasa. Tamra Parpadi, these two are very specific. And you can use Arogya Vardhini also. And for some patient, Kamaduda Rasa is needed as the gastrointestinal issues or acid peptic problems may persist. And GERD may also persist. So Kaidaryadi Kashaya is also good as an Anupana along with this Rasaushadis. And Adisara, Ashtakshari Guliga, which contains this, what do you call, Ahibena is also there. Ahibena Asava and the Karpura Asava is also good and you can use it. And one of the best use of even Upavishas are very good. Even the Ganja can be used in many of the cachexia. And I have used the Ganja in many of the cachexia cases as a lehya, and it is in Ananda Gandha. There is a lehya called Panchara, this Rasayana, Vijaya Rasayana. So Vijaya Rasayana can be used for those patients having cachexia. And for neurological pain, Karaskara is also good. Along with Karaskara Churna, you can add this, what do you call, the Subhavishas can be used. Karaskara along with the ginger or along with the Nagara, you can make it into pills. So these Upavishas are also very useful and it is explained in Rasa Tarangani, all the properties, and you can see the much difference in many of the patients. And Bhaladaga you can use, but in Kerala we are not using much, and I am not using it much. Bhaladaga Rasayana can be used in many of the anorectal cases, and you can see that the best one is while using Bhaladaga Rasayana, Bhaladaga Kshirapaka is very good, very tolerant. It is very tolerant to all types of patients. Bhaladaga Kshirapaka, and in diseases of anorectal cancers, this Bhaladaga Rasayanas and Bhaladaga Prayogas have great role. Even Bhaladaga Kshira Vardhamana Prayoga of Valadaka have great role in curing those pathologies. Next. So Amla Pitta we have already discussed, and the best one, if a patient is having cancer and having Amla Pitta, Swarna Sivda Shekhar Rasa is the best choice which you can manage the patient. Swarna Sudha Shekhar Rasa. And you can also make use of Kama Dudha Rasa and the Padyaksha Datradi Kvadha. It's a good anupana for all these type of gastric cancers, gastroenterological cancers you can use. But in the later stage of liver cancers, or like the later stages of liver cancer, we will be very helpless. Even in the advanced stages of the pancreatic cancer, so it is very hard to treat. But patients suffering from these gastric irritations, Swarna Sudha Shekhar Rasa can be a choice, and we should need an integrative approach for handling these patients. When hepatocellular carcinoma, we can give the Tamragarbha Potli and the Hemagarbha Potli, a combination of Tamragarbha and Hemagarbha Potli and Swarna Sudha Shekhar Rasa. So in all these, the Padyaksha Datradi Kashaya, which contains Padyaksha Datri, Bhunimba, Nimba, Rajani, all these are good drug, very mild one, and also stabilizes the Pitta. So it is a good anupana. Next. Kritshula and Gulma, Sringa Basma, Pravala Basma, Nagarjunabra Rasa, Kalyana Kshara, Shangavadi, Hridayarna Rasa, all this you can use in many of the cases. So cannabis question has arisen, is it legal? There is a problem with many of us. We need to go beyond we need to address it. We have to take special permissions. Some of the companies, they have got permission of this, using these drugs. But for treating cancers, this cannabis is needed, and for pain relief also we can use cannabis. And these cannabinoids, they have great role in curing pain, and the patient will also get a feeling of well-being. And in many of the palliative cases also we can use cannabis. So this properly Shodhita Ganja is very good, Vijaya is very good, Vijaya Rasayana is very good. So we need to seek more permissions from the authorities to treat cancer cases with this. So some regulations should be made in that regard. Next. Mudra Kritsra can be happen. Rasasindura in Gokshra Kvadha is a good choice. Next. Shiva Guliga. That is a very good choice, in which you can see if any Medo Dhadu is affected, you can go for Shiva Guliga. And even Meda Chedakaram Chekshmasyamanam. So that is the property of Kanmada. Kanmada means Shilajit. So Gomutra Shilajit is the content in Shiva Guliga, and it is being made bhavana with lot of rasayanas. And Shiva Guliga is a very good choice for Medo Dhadus are involved. And even with patients with problems of Medo Dhatu, you can select Shiva Guliga. So Egradvigaras, we can discuss the cancers of the liver, Mandura Vasma, then Vasha Gulucha Kadha. We have already discussed the case with what do you call Kanda Basma, then Annabedi Sindura, Kasisa Basma. It's a very good choice in many of the cancers of liver and spleen. And also, one more thing, liver and spleen, and also leukemia. For treating leukemia, and this Kasisa Bhasma is good, getting some of the response. And Kasisa Bhasma you can give along with the Mahatiktaga Grida. Mahatiktaga Grida is a very good choice for giving Kasisa Bhasma in those cases. Next. And these are some of the single drugs which can be used in different cancers. Hingula, Valsanabha, Kasisa. And Hingula you can process it with what you call Balladaga Taila. Then it will be more potent in dealing with cancer cells. And many of the cancers you can use. Next. Why Hingula is useful? It is Kababaha, Pliha Kamalahara, Jadaragni Janana. Next. Valsanabha is very good as Dibana and Pachana, Plihodara, Yogavahi. Next. Next, Valsanabha is contraindicated in some of the condition. You should note this. Hriddaurbalya, Bala, Vruddha. Next. Kasisa is good in Jwara, Pliha. So the spleen and liver is affected, you go for Kasisa. And it is belly also. Recta Sanjananambaram. That's why it is related to the cancers of blood. When in leukemia patients, you can use it. But some of the times you need to combine the therapies. Next. Level of action. If the Kajali is there, Parpadi is there, Rasa Sindura is there, Rasagarbha Potali is there, it is having action in different angles. The level of action differs. The particle size differs. The level of activity differs. The chemistry differs. So the activity also differs. Next. Next. Some of the yogas which you can use in cancer therapy, Jayamangala Rasa can be used very well in cancers of the lungs, lung cancer. Very well treated lung cancer in a patient, I have given a combination of Abraga Bhasma, Pravala Bhasma, then a Samira Pannagarasa. Abraga Bhasma, Pravala Bhasma, and Samira Pannagarasa. It worked very well, and the lesion has regressed much. Next. Sanjeevani Vadi can be used in many of the cases, most of the cancers, for eliminating the toxins. Sanjeevani Vadi can be used very well. Next. Lakshmi Vilasa Rasa, even in fever, starting from Jwara, Rasa, Swasa. Many of the cases we needed Lakshmi Vilasa Rasa in many of the combinations. Next. Arogya Vardhan Rasa, we have discussed in detail about its benefits. Next. Samira Pannagarasa, very useful in lung cancers. Samira Pannagarasa, you can combine with Siddha Magardaja, Abraga Bhasma, and Pravala Bhasma. You can combine these. Next. Rasa Sindura can be a combination for all the Rasa Aushadhis useful in cancer. One part you can add Rasa Sindura. It will enhance the combination, the potency of the combination. you can use it. And even in Gridapana, Gugulu Tiktaga, you can use Rasa Sindura along with that. Next. Malla Sindura is very specific. It is having specific effect in lesions of lungs and even many of the neuromuscular cancers. Malla is very important drug in specifically acting in many of the cancer tissues. Next. Siddhamagadaja, as we have told, is a excellent tonic. For every patient, you can use it in every stage. It will increase the bella of the patient, and it will augment the success of your other medicines. Next. Abragabhasma, we have already told, as a rasayana, you can use it well. Along with it, you can use the Swarna Bhasma as well as Hirak Bhasma for rasayana purpose. Next. Saridala Bhasma is having excellent result in respiratory cancers, specifically used, and even in many of the tongue cancer, many of the oral cancers, it is good. Next. Pravala Bhasma, very specific to lungs. Next. Kanda Pashana, we have already told in Kamala Chikitsa, for the liver cancers and the liver pathologies, you can use Kanda Pashana, Kanda Bhasma. And in Kerala and in some of the south region, there is another combination called Ayaskanda Rasa Sindura. It's a very peculiar combination and is having high value in cancer therapy. It's a slight different combination other than the normal Rasa Sindura. There are a lot of bhavanas are there, and even Kanda is there, and the Kanda and the Aloha is there. So the method of preparation is different. Next. This is a pottery. Next. Kasisa, we have already told. So in Rekta Vahasrodas, it is having great action. And actually, if it is being processed to a white material, the processing of Kasisa is different. When it is changed to a white Bhasma, there's a lot of process behind, and it can be very well effective in leukemias. So it is called Ayavalla in Siddha. There is a preparation called Ayavalla, and it is actually white in color. It is not a red color. So it will specifically act in the white blood cells. So it's having high potency in it, and it's very tedious to prepare. It's different from Kasisa Bhasma. So it is Kasisa Bhasma we can use, but this Ayavalla is more potent in leukemia because it acts in white blood cells. Next. So this is where we can see the Nityananda Rasa, which is having high tumor specific activity. You can combine with Tamra Bhasma. You can use it in many of the tumors, cancerous lesions, and in lymph adenopathies and lymph involvement. Next. Okay. Next. We are winding up. So Ayurveda can contribute much to understanding cancer causes, vulnerability and predispositions relating to Prakriti, provide clues in studying the signaling and control mechanisms in relation to concepts of Tridoshas, elaborating concepts such as Agni, Ama, Ojas, Bala, etc. Not any magical remedy as anti-cancer drug, but you have to account and treat all these in understanding the cancer pathogenesis and can play a good role in prevention, and Ayurvedic therapies comprising Rasa Chikitsa need to be explored more. And thank you so much for your uh, patient listening, and you responded well. And I am very happy that many of our interactions you responded well. Very happy, and I hope everyone will apply all this in your patients. Thank you. Thank you so much.
Thank you so much, Dr. Anand sir, for such an
Thank you.
informative and insightful session. Your clear explanations and practical approach to the subject were extremely helpful for all of us. On behalf of the Ancient Ayurveda and all the participants, I sincerely thank you for taking time out of your busy schedule to be with us today and for sharing your valuable knowledge. We truly appreciate your support and guidance, sir. Once again, thank you.
Thank you. Thank you.
Yes. Respected doctors, after the session, we will be sharing the feedback link on your registered WhatsApp number. We are requesting you to share your valuable feedback about the topic, and you can also suggest the topics for the upcoming sessions through that link. Thank you. Now, I'd like to invite Dr. Vishak sir. Dr. Vishak sir is currently working as a professor in the Department of Rachna Sharir at Sri Swaminarayan Ayurvedic College, Kannur, Gujarat. He is also a valued member of the expert committee of the Ancient Ayurveda magazine and a trustee of the Ancient Ayurveda Foundation. I kindly request Dr. Vishak sir to please felicitate Dr. Anand sir for today's session.
Thank you, Rishi. Am I audible?
Yes, sir, you are.
Thank you. Dear Dr. Anand sir, I extend my sincere gratitude and heartfelt thanks to you for delivering the enlightening session on Rasaushadhi in cancer management. Your depth of knowledge, clarity of explanation, and practical approach to the subject made the session highly informative and clinically relevant. The way you integrated classical Ayurvedic principles with contemporary perspectives on cancer management was particularly valuable and inspiring for all participants. We truly appreciate the time, effort, and dedication you have invested in sharing your expertise with us. On behalf of Ancient Ayurveda and all the participants, I sincerely thank you, sir, once again for your guidance. We request you to kindly accept this small token of appreciation from our immense love.
Thank you. Thank you.
Sir, can you answer questions in chat box, please?
Yeah, ma'am. Next session, we are going to the question answer session. And thank you, Vishak sir, for the wonderful words and felicitating. Now, participants, if you have any doubts or questions, you may please drop them in the chat box or use the raise hand option. We will first take the questions posted in the chat box. After that, we will announce the name of those who have raised their hands, and you will be invited to unmute and ask your question directly to sir. We kindly request everyone to keep your mic muted throughout the session unless you are invited. Thank you so much for your cooperation. And now I am requesting Dr. Vishak sir to conduct the question answer session.
Thank you. Sir, Anand sir.
Okay, fine.
Okay, can we start?
Yeah.
Okay, so there are so many appreciation from our participants.
Thank you.
In between, some questions are there.
Yeah.
First by Dr. Rajiv. Where do we get the combination that you have given for prostate cancer?
Yeah. Actually, that combination is not now in market, but I have been preparing it. I have been using it. So it is actually it is in Rasaratna Samchaya, the reference. If you can try, you can prepare it. Or I have been using it in many of the cases. It is also very good to decrease the prostate specific antigen levels. When if it is good for cancer, prostate cancer therapy, as well as to decrease the PSA level and comes to normal. It is for observing that is good, and the prostate symptoms also much relieved. So it is actually in Mutra Krichra Chikitsa of Resurrectnam Samchyan. As I think it need to be filled inside the cowrie and all. The industrial production, large scale production is not feasible. That's why many of the companies are not taking it. But I have studied the that formulation and find it very useful. So there is a lot of such formulations in Resurrectnam Samuchayam, Paishajaraknavali, etc., which we need to explore more. All are not in the market, but all our doctors just prescribe what is available. But we need to dig more treasures out from this. Thank you.
Thank you, sir. Next question by Dr. Sarida. What can be used in squamous cell carcinoma of any region which is fast spreading?
Yeah, it depends upon the uh, which which type of cancer, which area. So the area is also very important. But one or two things which I could comment on this is actually you can use Portlace very well. The Hemagarbha Portly along with Trigarbha, Tridadu Garbha Portly and Tala Garbha Portly, you can combine. And this in a high dose. I am suggesting a dose which is not 8 circles like that. It should be around 50 milligram minimum. Then it is good. And by assessing the particular area, you can add on other medicines. Along with this, you need to protect the belly of the patient. So you can, along with this, parallelly, you can give a combination of Hirak Basma and Swarna Basma in a 50 mg dose. You can give. It will work more.
Thank you, sir. Next question by Dr. Ashia. Dose of Tamragarbha and Hemagarbha Portly. I think it is being answered.
Yeah.
So next, moving on to another question by Dr. Ashia. Dose of Kasisa Basma and Ayavella.
Yeah, that is a good dose is a 250 milligram per day. 200 milligram is also good dose, and Ayavella 200 mg or even 100 mg is also a good dose. So if you are using Kasisa Basma, 200 milligram to 250 milligram is a good dose, and Ayavella 100 milligram per day.
Thank you, sir. Next question by Dr. Sarida. Can we give Rasaushadhi while the patient is on chemotherapy? Any reaction?
Yeah, that is a good question. Usually, in between the chemotherapies I am doing nowadays, you can see the chemotherapy, they are having long term chemotherapies are there now. So in a lung cancer patient, I have seen while she is in chemotherapy alone, she is so tired, she is having no appetite, a lot of cough and all. She was a lung cancer patient. But after starting our medicine, along with that, I have started our medicine, include I have given to him Nityananda Rasa and Tamravasma, the combination of that, as well as Siddha Magardaja, Pravala, and the Samira Panag. So I have, after starting this, by 1 month, around 30 days, the patient responded well. The patient got normal appetite. The patient got relief from cough. The patient was coming to normal. So side by side, the chemo and our medicine went on. But I advised her just to avoid our medicines 1 day before chemo and that day and after chemo. So usually, if you avoid, in many of the patients, I am telling 2 or 3 days before chemo, you can stop our medicine, and after 3 days of chemo, you can restart the medicine. Most of the cases. So side by side, we can give, and many of the patients I am seeing good result if we integrate the all these treatment. But for some cases, chemo is not needed. So it depends on the condition, the depend of the patient, how it responds. But the important thing is that you have to check the response. Then only verify the response. So when I administered our medicine along with the chemo, it went well in this lung cancer patient. Very good result. Only on that day and previous day and after 1 day, she is taking our medicine. No problem and very good result.
Thank you, sir. Next question by Dr. Jyoti. Can you share the Signet ring cell carcinoma case?
Which one?
Signet ring cell carcinoma case.
We have discussed that?
No, sir.
No.
Okay. Next.
I have discussed the case of prostate cancer. Then I have discussed the case of cholangiocarcinoma. These two case studies we have discussed.
Yes, sir. Okay. Next, moving on to Dr. Ashia, dose of Rasa Sindhura.
Usually for cancer treatment, I am giving for some patients extra dose, say 2 ratis for 21 days and all. And after that, we can reduce the dose to 1 rati, that is 125 milligram. So if the patient is having more pain, we can have 2 to 3 ratis for 7 days, along with the Betelgeuse. You can give Rasa in a higher dose. But the normal dose is 1 rati for a cancer patient, 125 milligram. For children or having 12 years, less than 12 years, you should give only 50 mg. That's all.
Thank you, sir. Next question by Dr. Sakshi. Do you suggest chemotherapy or radiotherapy if the patient comes directly to you?
Yeah, this is a very good question, and many of the times, if the patient is showing good bala, without much, without much weakness, I start our treatment. And I tell them after 30 days or 40 days, we can do some investigations. We can check again. We can go for the response. We can assess. And again, if it is responding well, we can continue. So many of the cases, if the patient is not bothered about the disease, or they are ignorant about the seriousness of the disease, we are getting more sound responses. They are getting cured. If they are not bothered at all, or if they are ignorant at all, we are getting many good results. So that mind is also a great factor while treating the patient. Their mind should not be affected. So if they are comfortable they are not having any serious weakness, then we can start directly our treatment without going to the other thing. But after 21 days, you need to assess the patient whether he or she is okay. And again, after 1 month, you should go for the test, whether it is working or not. And one more thing I should add, that if the patient is not dropping on weight, most probably our treatment is working. But if the patient is continues on dropping weight, losing weight, then our treatment is not working. So that is one of the things. And the patient get more weak. But in most of the case, the Bella, most of the cases, the Bella is enhanced much by our medicines. Thank you.
Thank you, sir. Next question by Dr. Srividya. Does the choice of Rasaushadhi and dose change according to stage of carcinoma?
Sure, definitely. So actually, we want tell it for this type of cancer, this medicine. Maybe there is a greater chance of that medicine working in that cancer. But many other medicine we need to introduce. That's why I have told many of the systems, these Rasaushadhis are working. So according to the system, you can select. It need not be one or two medicine anti-cancer drug against this. So your choice can be others. It will work. So you have to evaluate. You have to decode to our Jvaradirogas, whether it is Jvara, whether it is Raktapitta, whether it is Kasa, whether it is Gulma, whether it is even some of the diseases are like what you call Vada Rekta. We can give treatment for Gulma, we can give treatment in cancer patients of Vada Rekta treatment. So it is not definite. It varies. You have to go into the patient through the windows of the symptoms, and you can select, you can decode the problem in her, and you can freely use those medicine. You can think freely. You should think freely, not definite to a certain medicine. Okay.
Thank you, sir. Next is question. It is regarding a carcinoma, but not in our topic. Can I ask, sir?
Yeah. Well,
By Dr. Rakesh, the treatment protocol for muscle invasive bladder cancer.
muscle invasive bladder cancer. Actually, we need to think it more, but we can explore some of the medicines which can be used in Mutra Aghada Chikitsa. Mutra Aghada Chikitsa. Along with that, you can combine it with Tamra Bhasma. You can combine some of the like Trivikrama Rasa. There is a choice in Mutra Aghada Chikitsa in which it should be focused on the bladder, urinary bladder and those system. Along with that, you have to contain the tumorous activity on the Mamsa Dhadu. So you can combine Trivikrama Rasa and this, what you call, Tamra Bhasma. And for that, you can use Trivikrama Rasa in a 250 milligram, and you can combine 30 milligram of Tamra Bhasma. And this you can use, if the patient has appetite, you can use in Vastyamyandaga Gruda. This is one of the thought, but we need to explore more and see the responses in the patient. This is only one of the thought which I could share.
Thank you, sir. Next, another two more such questions are there, sir,
Yeah.
which is related with blood. One is treatment of leukemia, and another mantle cell lymphoma, stage 4.
Yeah, that is stage 4 is very difficult. And leukemia, as I said, in some of the cases, initially, the starting thing, this Kasisabhasma and Drakshadi, all those works. But I'm not quite confident to tell all those cases are working. Maybe some other doctors are treating. I am telling my experience. So in that, this Ayavalla, which I have told, it's a white basma of iron, and it's is specific in those leukemias in every stages of that. Actually, it enters into the. We need to have medicine acting on the bone marrow as well. So this Kasisa Basma conventionally it works on spleen and liver, but we need to go more deep in these cases, like to the bone marrow level, so that this white Basma is needed, Ayavalla is needed. This, but to prepare it, it is a tedious thing, and it is not that much available. That is the problem. So you can also make use of Mahatiktaga Grida or Kalyanaga Grida along with these basmas. That is a thing which we can try, but according to my experience, we should manage this as a after a care in modern medicine, we can do it. That's my choice. Maybe many other doctors may be doing, but my choice, my preference will be like this. Okay.
Thank you, sir. Dr. Arshia is asking whether we can buy Basma from you, sir.
This Lekulogeshwar Rasa, which is not available, I can provide for some of the patient, but not all, because I am using it personally. But if the case is so emergency, I can share for some of the patient, not as an industrial thing. I could not do, but for some I can do.
Thank you, sir. Next by Dr. Mayur. Can we give Nityananda Rasa in any tumor?
Yeah, sure. Nityananda Rasa is acting very specifically in tumors. So you can see even Tamra, Kamsya and all there. So very specific that I have told in the presentation. It's very specific in tumor depletion, and even you can combine it with the Tamra Basma.
Thank you, sir. Next again, another one more out of the session question is there. Rasaushadhi for bone cancer by Dr.
Yeah,
Soumya.
yeah, that I am also not dealing with that. I am telling what I am practicing, not in a theoretical mode. I have delivered the thing which I am doing. So I haven't dealt with the bone cancer. So I'm not taking the question for the time being. So you can use some of the, you can explore that by the many of the Visha Chikilsas. It passes through Majja and Asti, and then when it reaches Asti and Majja, the Anthyam will be like that. The Visha Vegas are there. So some of that Chikilsas you can explore, and even some medicines such as which I have told, like Ayurveda, has good effect, but it is little bit tedious to make it. I have tried it in one or two cases, got result, but not in many.
Thank you, sir. Next also it is another question, sir, regarding lung cancer.
Yeah.
Rasaushadhi in
Yeah.
lung cancer.
Yeah, lung cancer you can use it. Definitely, I am using it. In lung cancer, I am treating. It has very good result we can have in lung cancer. Usually in lung cancer, I am using a combination of, which I have already discussed, a combination of three. One is Samira Pannagarasa, then Abraga Basma, Pravala Basma. These three combined. Along with that, this I will give in the night time, and in the morning I am giving Nityananda Rasa and Tamravasma. This I am giving. Along with that, Bhargi Kanadi Kashaya. I am giving it as an Anupana, the Bhargi Kanadi Kashaya. It is working. In some of the cases, I used to give Rasagandhi Medica in some of the lung cancers. Lung cancer, we have a good result because it doesn't spreads fastly. We can have some time to treat. So we can take lung cancers. It is working.
Thank you, sir. Next question by Dr. Srividya. Can avachurnana of Rasaushadhi can be done over open wound of carcinous lesion?
Yeah. There is a good question. You can apply it, and even the Hingula, all these have good anti. They have good healing action in cancerous wound. You can even directly apply this dhupa of Hingula and turmeric to externally as in cancer wounds. And even many of the potalis, you can grind it, like Hemagarbha potali, Talagarbha potali, Tridhadu Garbha potali. All this you can grind it and you can apply directly. So it has good effect.
Thank you, sir. Next question by Dr. Abarna. For how many days Arogyavardhini Vadi can be used?
Yeah, that is a controversy regarding and Arogya Mandalam Sevidam Sesham. But it is an interpretation. 41 days is not, it is not restricted to 41 days. It is Mandala Kushta. For Mandala Kushta, it is indicated. I have been using Arogya Vardhani for long. For 6 months, you can use, no problem. It only increases your health. Can be used as a Nitya Rasayana. Nothing to happen. It is a very good combination. So, Mandalam, it is just interpretation. My interpretation on is it is for Mandala Kushta and not for Mandala Kala. So you can use it in for long days. For 6 months you can use, no problem. I am using it in patient for 6 months or even 1 year. No problem at all. You can even test the liver functions, renal functions. Nothing will happen. Your liver function will improve. That I have already told in the case of cholangiocarcinoma. You can see even in the cancer patient, the liver functions have improved well within 30 days in a cancer patient. So it is very good to use. Nothing to fear.
Thank you, sir. Next question by Dr. Keyur. Can we use Tamra Sindura in any kind of CA?
Yes, Tamra Sindura can be used. Tamra can be prepared in many ways. All these preparation procedures can also have impact. Tamra Sindura in many of the parts of the country, they are preparing in different way, like Somanadiya Tamra Basma. This can be applied directly to the lesions, and even it can be taken. Tamra is a very good Rasaushadhi which can be used, but use the Tamra Basma having a very good quality. You have to test it. You have to ensure it. Otherwise, it is dangerous. So please use it in a very good source. You can test it in what you call in random samples and ensure the quality. And dose is also important. Tamra for 130, it is too high, even though the dose in some of the text, half the to 130, but you don't use it. You need to use Tamra, it is highly ruksha. So it is useful in small doses like 30 milligrams. It is very comfortable and the patient will tolerate it. You can use without fear.
Thank you, sir. Next question by Dr. Bhagya. Treatment for intestinal cancer.
Yeah. Intestinal cancer, as I have told, you can take some of the cases, the colon and rectal, that area. The Balladaga preparations are having specific role. Even Balladaga, a lot of preparations are there. But in Kerala, some of the formulations, they get some side effects due to the climate and humidity. But in outside Kerala and in north, you can use Balladaga very well. And also for every problems of the intestine, you also add Swarna Sudha Shekara Rasa. That is very good. This is having a very good soothing and cancer cure effect. Swarna Sudha Shekara Rasa in the intestinal area. And Arogya Vardhani Rasa you have to add along with this. And you can use Swarna Bhasma also. It will be having good effect in curing the cancer. But the stage of the disease also important. The stage, if the stage is in a advanced stage, it is bit difficult for cure, even though we can give some relief to the patient.
Thank you, sir.
Sadhya.
Thank you, sir. Moving on to next question by Dr. Jayasri. Can Arogya Vardhani Vadi be given prophylactically to patients having family tendency of CA?
Can be given, but I think more than the drug which we have discussed earlier, the tendencies and triggers, the other things should be corrected. This Arogya Vardhani can be used, but more than that, all those have more effect. This which we think it has more effect. Even the many of the stress, many of the endocrine disruptors, all those have more effect. Arogya Vardhani, if you are preparing it, then you can use it as prophylaxis.
Okay, thank you, sir. Next question by Dr. Nasreen. Which Rasaushadhi can be used in CA stomach?
Yeah, as I have already told, for all the stomach cancers, you can use Swarna Sudha Shekhar Rasa and Tamra Bhasma, Tamra Parpadi. Parpadi has some role. Swarna Parpadi. All these can be used along with the Arogya Vardhani Rasa. And sometime we have to address the Amla Pitta there by using Kamadudha Rasa. And sometimes with the formulations like Paidaryadi has to be given. And you can manage the patient, but you need to have a surveillance regarding whether it is the cancer is just responding, the patient is responding, or it is spreading. That is very important. You have to have a surveillance along with this.
Thank you, sir. Next question by Dr. Ashya. Dose of so many drugs are there, sir. Should I read?
Yeah.
Ayaskanda, Rasasindura.
Ayaskanda, Rasasindura, it is 130, 100 mg or 125 mg.
Kandabasma.
Kandabasma, even 200 mg can be given. 200 milligrams can be given per day.
Haradalabasma.
Haridalabasma, actually the dose is less. 50 milligram is enough. That is enough for Haridala Bhasma.
Malla Sindura.
Malla Sindura, you can give up to 1 jati, that is 125 milligram.
Siddha Magaradhwaja.
Siddha Magardhaja, usually an adult dose is 1 jati, or you can have 100 mg, but you should grind it well for 3 or 4 minutes before taking with the honey or water granule. Samira Pannagarasa up to 125 mg per day can be given.
Thank you, sir. Next question by Dr. Shailaja. Which Rasaushadhi for anorectal cancer and hepatic metastasis in patients does not want to take chemo?
Yeah, you can definitely try Alladaga Rasayanas. It is very specific. Alladaga Rasayanas are very specific. Along with that, you can use this Nityananda Rasa plus Tamra Bhasma. This is one. Along with that, you have to preserve the bela of the patient. So if you can use Swarna Bhasma 50 milligram per day, that will be more ideal. It will work more.
Okay, sir. Thank you. Next, Dr. Shivam. He has presented a case, sir, and asking for the treatment.
Yeah.
A patient having cancer showing some placental cells in gallbladder, cholecystectomy done. Patient complains of some back pain and low appetite, and 8 to 10 kgs weight loss in last 1 month.
Yeah. So this that I have already told about when you see a patient's weight loss, you have to be more serious. At times, the patient condition is such a way that it will not respond to any type of treatment. So better, my advice is to make him go to further investigations. Maybe some negative developments may happen. Our response may not be ideal. I also got some of the patients in which the weight loss happened. When you see a weight loss, it is better and safe to refer for further investigations. I think some negative situations are prevailing in the patient. So, without wasting time, you need to refer it for further investigations.
Thank you, sir. Next question by Dr. Ashia. Should we stop sugar completely in all cases of CA patients?
It is very better. It is better to stop the sugars. That is better.
Thank you, sir. Next, out of the session question is there. Treatment in vocal cord CA.
Yeah, that is a good one. You can treat. I had treated a case in larynx, CA larynx, and even in thyroid, we will get good results. In larynx, I have given the Mandura Bhasma and the Rasa Sindura. Along with that, and then another time, I will give Abraga Bhasma. So this worked very well, Mandura and the Abraga Bhasma. Then you can also use Rasagandhi Medical there. In those soft structure, this Rasagandhi Medical 500 milligram is useful. So at a time you give Mandura Bhasma, Abraga Bhasma combination, then Rasagandhi Medical. Along with that, you can go for Patyaksha Dhatriyadi Kashaya or Nimbadi Kashaya as Anupana. This is having good result. By assessing the patient's symptoms as well as the condition and health status, you need to switch over the formulations and the medicines.
Thank you, sir. Another one more question is there, sir, like that by Dr. Manor. Is there any management for glioblastosarcoma in Ayurveda?
Yeah, I think is it glioma in brain tumor?
Hope so, sir.
Yeah. So there is some management, but you can arrest the progress of the disease. That is it. But in many of these cases, you can see that it is observed that the progress of the disease can be arrested. So the one of the best one working on those is a combination of Abraga Basma and Siddha Magadvaja along with the Gugulu Tiktaga Grida. Combination of Abraga and the Siddha Magadvaja along with the Gugulu Tiktaga Grida is a best combination. And another option for this type of cancers, Kanda Rasavilla. Kanda Rasavilla, but you have to restrict the use for 3 to 7 days and then give a gap, and again you can use it again as a course of 7 days intermittent. So you can control the progress, you can arrest the progress.
Thank you, sir. Next question again by Dr. Ashia. Can we use Avaleha or Asava Arista in cancer patients?
You can use it, no problem, but you have to confine its dose. You don't use it in more quantities. You have to restrict the doses. That's my advice.
Thank you, sir. Next question by Dr. Sindhu Madhav. Preventive measures for CA.
Yeah, that we have already discussed. According to our nature, according to our prakriti, we have to optimize our daily routines, sleep, then food, and mental balance that is needed, and avoid as much as endocrine disruptors. Even most of the modern medicines are endocrine disruptors. You refer the pharmacopoeia of modern medicine, you can see most of them are endocrine disruptors. They are disrupting the environment. You can see many of the drugs are even carcinogenic. So avoid maximum those carcinogenic synthetic drugs. Avoid maximum endocrine disruptors and design our daily routine a balanced one. That's the best thing which we can do. And having good exercise.
Thank you, sir. Next, again, two more out of the question is there. One is oral cancer and breast cancer treatment.
Yeah. Yeah. Oral cancer, actually, oral cancer, it's a very vast area. That's why we cannot incorporate it all. But oral cancer, we can have good result. And the best result we will get in a Rasagandhi Medigu for oral cancer. 500 mg of Rasagandhi Medigu is very good, along with the Kandarasavilla 50 mg. Then Nityananda and Tamravasma, that combination. All these three can be given with local application. Local application has got very good impact. You can use some of the decoctions like tribala and the cow's urine, fresh cow's urine as mouth washes like kabala, and some of the potalis can be rubbed and applied locally like Hemagarbha potali and Shila Garbha potali can rub.
Thank you, sir. And the last question in our chat box.
ഇവിടെ ഇപ്പൊ 2 മിനിറ്റ് കഴിയുന്നു 2 മിനിറ്റ് മേഡം കഴിയുന്നു.
Okay, sir.
Okay.
Next, it is also an out of the session question. In gangrene, can we stop amputation by Rasaushadhi? And can we improve the condition?
Yeah, some of the cases I have tried. Some of the cases it worked well. It depends upon the extent and severity and the patient's cooperativeness. So the medicines which worked well, it was observed this. We have a combination of Tripala Gulgulu and Rasa Sindhura. It's called a Vrinari Gulgulu. Vrinari Gulgulu was effective, found to be effective, along with this Kvadha of Manjishta, the Kvadha Sanapana, and some Jaluga Vajrana have conducted there, and Shalana with Tribhalam, and the cow's urine. Is also the local cleaning is also very important. Along with that, Ayaskanda Rasa Sindhura, if you give it, it will also, so the circulation to that area can be corrected. So in some of the patient it worked well, but you need to have very cooperative patients. You can try it.
Thank you, sir. So the chat box session is over. We have some hand raised. Can I call, sir?
Yeah.
Okay. So the participants, I will call upon your name one by one so that you can unmute and ask your doubts.
Sorry, sir, for interrupting. Actually, sir is conducting the class from last 2.5 hours and more. So I'm requesting participants, please stick on the topic and concise your question and ask it as more as possible fastly. Okay, thank you.
Actually, I had another meeting. I am now. There was a Rasa Dishwara Darshana, a series of talk for a clinical Rasashastra, and a team is now preparing that textbook. So that meeting is now scheduled after 9:30. So please ask as soon as possible.
Sure, sir. Thank you, sir.
Sure, sir. Thank you. Dr. Jayasri?
Namaste, sir. My question is answered, sir. Thank you so much, sir.
Thank you.
Dr. Saiful?
Assalamualaikum, sir.
Yes.
Firstly, I am thanking you for your nice presentation, sir. I have a question, sir. How can we manage CA cervix, please, sir?
CA cervix. So okay. So CA cervix, you can manage it well. We have specific medicines that acts, which I have told, the Nityananda Rasa and Tamra. The combination of Nityananda Rasa 200 mg and 30 mg of Tamra Basma is a dose for that. Along with that, you have to protect the bella of the patient. So Swarna Basma should be given. And Rasagandhi Medugu is another effect, which is drug which is having specific effect, and 500 mg of Resaganthi Medico is needed per day. Along with the Pam Jaggery, you can use it. Along with that, Nimbadi Kashaya, Nimbadi Quadha or Gugulu Tikta Quadha can be given as Anupana, and the douche with Tribhala Quadha and Gomutra, cow's urine. Douche every day is very good for this. Thank you.
Thank you, sir. Sir, I would request you, how can I communicate with you, sir?
Yeah, they will give my contact number.
Thank you, sir.
Thank you, doctor. Next, Dr. Saurabh.
Good evening, sir. Sir, my question is that can we use Ras Aushadhi in the Basti form, like while preparing the Basti, can we administer it
Yeah.
with the Basti medium?
Yeah, you can explore it, but I have no experience, but it should work. If you give it through mouth, you can also give it through other routes also. You can explore it. Since I have no experience, I am not telling it, but you can do it.
Yes, sir. And also, sir, Suvad Navan, sir, can be used in cancer. I've read it once anywhere. So, any idea about that, sir? Any Suvad Navan preparation for cancer?
Which one? Which one?
Suvad Navan, sir. Navan mixed with Suvad
Level.
Basma.
Yeah, yeah.
Swarna 11.
Yeah. Swarna 11. No, I haven't used much.
Okay,
But
okay, sir.
many of
Thank you.
the companies, they are having, instead of Swarna Basma, they are using Swarna 11.
Yes, sir. Yes, sir.
Yeah, yeah.
Thank you, sir.
Thank you. Next, Dr. Sakshi.
Yes, sir. Rasagandhi Medgu, actually, I am from Maharashtra. I can't understand this.
Yeah, that is actually Sagandha Murchida, but Niragni. So it is pounded with the 50 times herbs. Lot of herbals are there. It is pounded well, and it is having 5 or 6 mineral drugs. The combination you can get from IMCOPS, Indian Medical Practitioners Cooperative Society, ADAR. So the yoga is in that text of Adayar, and also you can purchase it.
And it's same about
But
Kanta
you have
Rasagilla.
to, the same thing. It is actually a South Indian one, more in Siddha. You can get from Adayar IMCOPS. And you have to restrict the use because it is not Agni Paga, especially Rasagandhi Medical. For 41 days you can use as a course, and after that you can put a gap of 2 to 3 weeks, and again you can reuse.
Thank you, sir.
Thank you, madam. Next question by Dr. Ashia.
Sir, could you suggest us a good source to buy these all bhasmas and all?
Yeah, many sources are there. In North India, Sri Dut Pabeshwar has standardized techniques. Many of them I'm using, no problem. Then in Uma Pharmacy, it's renowned Uma Pharmacy is there. Then in Kerala, Siddheshwara is there. Then in Tamil Nadu, this IMCOPS is there. In Kashmir is there. Poonch Pharmacy is there. These are paid well.
Thank you, sir.
Thank you so much, sir. The question session is over. Thank you for
Thank
your
you
valuable.
so much.
Thank you so much, Anand sir. Thank you, Ishak sir.
Thank you.
And thank you all the participants for being here. Good night, sir. Good night, everyone.
Nice.
Thank you.
Sir, you are muted. You are mute. Anand.
Thank you, everybody, and I hope everybody will make all these practical into practical, applied. Thank you. Good night.
Good night, sir. Thank you.
Thank you, sir. Good night.
Good night, sir.
Night.
Thank you, sir.